Bismillahirrahmanirrahim. My name is Mohammed Ahmed. Yesterday, I talked about status epilepticus, its definition, how different drugs are used in different timelines to treat status epilepticus. Now, in this video, I will exactly tell you what sort of words are used in your Navale question for status epilepticus to make your mental framework. If a question asks a Labrador or a dog is in seizure for 5 minutes, then what is the first line of choice? That is going to be benzodiazepine, diazepam in dog, or midazolam in cat. Now, what is the next advantage? Usually they will ask the cat is in active seizure and you're not able to find a vein. Then what is the next step? The next step is to give midazolam intranasally. Watch for this word. It has an alternative route. If a question asks that giving benzodiazepine for the 0 to 5 minutes has not improved an animal, then what will you do next? Like for the 20 minutes, the GABA receptors, that is actually a brake that suppresses neuronal current are on the surface. So giving benzodiazepine for the 20 minutes can help to stop seizure. But if a question asks that giving multiple doses of benzodiazepine has not stopped seizure, then what's the next step? The next step is to give an IV propofol or pentobarbital slowly. This is again a GABA agonist, but it acts differently from benzodiazepine, and the other drug along with them is levetiracetam. Now these are the second line because at that point the benzodiazepine efficacy has reduced due to internalization of receptors, but barbiturate works on different subunit of the GABA to again create that brake that stops neuronal current. The seizure is super refractory or has not been controlled by IV propofol, pentobarbital, levetiracetam. Then after that, switching to CRI. How does CRI help? Propofol is a GABA agonist that works on a different binding site of the GABA. Therefore, giving after 30 minutes can help to stop seizure. Similarly, midazolam. Now, this CRI maintains a particular level in the plasma that keeps on attacking the receptors and causes the seizure threshold to increase. Levetiracetam, you can put an animal on levetiracetam with liver disease for a longer period of time. Like a question comes, a cat with hepatic lipidosis comes to you and it's an active seizure. The drug of choice is the levetiracetam because it does not cause hepatotoxicity or it is excreted renally. For pentobarbital, there are a few considerations. First of all, you need to give it very slowly because it can cause respiratory depression. The therapeutic level should be 20 to 40 microgram. Therefore, it is indispensable to check while you are treating animal with pentobarbital that its therapeutic levels are achieved. If they are below 20, then you have to reconsider the dose. If the level is 35 to 40 microgram per ml and the animal seizure has not been controlled, then adding levetiracetam would help at that point. And after 45 minutes to 24 hours, the seizure does not stop, then ketamine CRI becomes necessary because ketamine is an NMDA agonist. Now, glutamate is an excitatory neurotransmitter that acts on NMDA receptors. Now, after NMDA receptor activation, the magnesium will get displaced, sodium depolarization, calcium will go inside, and excitotoxicity will happen. And ketamine, just because it directly competes NMDA, becomes a drug of choice at that point. But when the seizures continues after 30 minutes, the prognosis becomes very poor. These are a few points you need to consider for status epilepticus, that how you shift drugs. Yes, lastly, I forgot pentobarbital level monitoring after 3 to 6 months, ALP and AST and its therapeutic level should be checked. Thank you so much.